Good morning. Tuesday, February the 17th, 2026, and I call the TennCare Subcommittee to order. At this time, I'm going to ask my dear friend, Mike Sparks, if he would open us in prayer and lead us in the pledge this morning.
Thank you, Lord Jesus, for this time fellowship, Lord, and thank you for this body that hopefully will make wise, discerning decisions, Lord. And Lord, I ask you to bless this country, Lord, and let us always be a voice for those that may lack a voice, Lord, and just grant us wisdom and direction and strength. Just bless our governor, bless our speaker, bless our president, Lord, and just give you thanks for this nation. We have freedom to debate issues, and ask us in your name. In the name of Jesus, amen.
Amen.
Please face the flag. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Right, at this time, Clerk, if you would open up the board for us to log in. All right. Clerk, would you please take the roll?
Mr. Chair, you have 5 members present. So you have a quorum.
Thank you so much. Does any of the members have any personal orders this morning? All right. Representative Love, you're recognized.
Thank you, Mr. Chairman, and I'm sure that many may have heard by now, and those who have not certainly want to take a moment and recognize the life of the Reverend Jesse Jackson, who transitioned early this morning, who was a pivotal influence in the era of civil rights, ran for president in 1984 and, of course, in 1988, and was a great influence upon many of our lives here. Matter of fact, in 2017, we in the Black Caucus had a chance to meet with Reverend Jackson in Cordell Hall building as he was talking about still efforts to increase voter rights and to reduce poverty. And so I'd like to, Mr. Chairman, even though we've had a word of prayer, if we could take a moment just to acknowledge the life of Reverend Jesse Jackson. Pause for a moment, if we could, Mr. Chairman, if that's possible.
Yes, sir.
Thank you. Thank you, sir.
Thank you. Any other personal orders? If not, we'll get right on into the calendar this morning. Item number 1 is by House Bill 2389 by Chairman Martin. We have a motion and a second. Sir, I believe you have an amendment. Is that correct?
Yes, sir.
All right.
It is 013445.
Motion to adopt. Is there a second? Second. I think that does rewrite the bill, right?
Yes, correct.
All
Yes,
right. We
sir.
need to get that added on here. So all in favor say aye. Any opposed? All right. So your bill as amended is in front of us.
Thank
So,
you.
all right.
Thank you, Chairman and Committee. This piece of legislation just establishes a biannual report produced by TennCare on the amount of psychotropic medications prescribed in Tennessee. All this data has been currently produced from open records requests, but will be more easily accessible for legislators and the public moving forward. It's been estimated that we spend over $480 million in Tennessee annually on these medications. This detailed report will bring transparency to the trends across Tennessee, and I'd like to thank TennCare, DCS, and the Department of Health for helping me in the language. With that, I stand ready for question.
All right. Thank you for that explanation. Chairman Sapicki, you're recognized, sir.
Thank you, Mr. Chair. Move previous question.
Previous question has been called. So we're ready to vote on House Bill 2389. So clerk, if you would open the board. All right. Madam Clerk, would you take the vote, please?
Mr. Chair, you have 5 ayes and no nays.
All right. Congratulations. You're moving on to insurance full.
Thank you, Committee and Chair.
Thank you. All right. Next, I see the next presenter down here, House Bill 2489 by Representative Capley. Sir, you are recognized. We have a motion and a second. You are,
Thank you, Mr. Chairman. Good morning, committee. I don't know that I've ever been in here, so it's the first time.
well,
It's awesome.
welcome.
Yes, sir. Yes, sir. Members, this bill is pretty simple. It prohibits TennCare from providing coverage or reimbursement for a medical procedure if the performance or administration of the procedure is for the purpose of the following: enabling an individual to identify with, live as a, or live as a purported identity inconsistent with the individual's sex, or treating purported discomfort or distress from a discordance between an individual's sex and their asserted identity. And that is what the bill does.
Okay. You've heard the explanation of the bill. So Representative Love, you're recognized.
Thank you, Mr. Chairman, and to the sponsor. In our current, and I try to keep up with what is happening with legislation, but in our current posture in the state, is this already prohibited, or is this going to be the first step in prohibiting this?
Representative Kaplan.
Thank you,
you're
sir. Good question, Representative. We passed a package, I don't know if it was last year, year before last, and this closes a loophole in that package. So this is already, there's a loophole in the law right now, we feel. Anyway.
Representative Love.
Thank you. Just for clarity, what's the loophole that's there that's being closed with this?
It's entitled,
Representative Kaplan.
Thank you,
you're
sir.
recognized.
It's entitled 71, Chapter 5, Part 1. It's, that would be subsection A, Part 1, 2, 3, 4, 5, through, oh, Lord, keep going. 5, through 7, and then B, 1 through 4.
Representative Love, do you have any other questions? Okay.
So I have B 1 and 2. Are there two other sections, or is it, because I see the section A 1 through 7. I see B 1 and 2.
Oh, excuse me, sorry. C as well, and then there's subsection 1, AB, 2, 3, 4, and then AB under that as well.
You're recognized, Chairman.
Representative Love, would it be possible for us to go out of session to legal and let legal clarify what we're doing?
Yes.
All right, without objection, we'll go out of session and we can ask legal that question.
Levin Crutchfield, Office of Legal Services. From my understanding, our current statute prohibits these procedures for minors specifically. And so this is saying that TennCare can't cover or reimburse for these procedures for anyone. So that's my understanding of the difference between the recently passed law and then this bill.
So just for clarity of that, currently it's for minors and this would be for the entire population that TennCare covers, correct?
So the current prohibition is just the provision of these services in general. It's not specific to TennCare or insurance. It applies to healthcare providers. And this bill is specific to TennCare, but it is broader in that it is not limited to minors.
Okay. All right. Any other questions for legal? Okay. Representative Parkinson.
You said it's not limited to minors, so this is for adults also?
Yes, this prohibits TennCare from providing coverage or reimbursement for this medical procedure for a person of any age.
Okay. Any other questions for legal? Did you have a question for legal or anything? Okay. All right. We're going to go back in session. Representative Capley, you're recognized, sir.
Yes, sir. Thank you, Mr. Chairman. This also does not apply. If you look at the summary of the bill, we can also go into the language as well, but it doesn't apply to procedures that would treat an individual's congenital, good morning, precious puberty disease or physical injury. So there are other limitations as well. It's not just a flat for everything.
Right. Okay. Representative Parkinson.
Thank you, Mr. Speaker. I guess I gave you a promotion, Mr. Chairman.
Got a big one.
So what does it cover then? What does it stop coverage from, if not those other areas?
Representative Capley, you're recognized.
Everything else.
Representative Parkinson.
I appreciate
mean,
that. Right, okay.
I wasn't trying to be
Right,
smart,
no,
you know.
okay. I don't know what everything
Just-
else is, but okay.
Anything not that.
Okay, thank you, Mr. Chair.
Okay. Chairman Speaker, you're recognized.
Thank you, Mr. Chairman. For the bill sponsor, just for clarification, if an individual has a congenital defect, then they would still be able to get medical treatment for that. But if it's an elective surgery type of thing, that it would be prohibitive. Is that correct?
That is correct, sir.
Thank you, Mr. Chairman.
Okay. All right. Everybody good? Representative Love.
Just for clarity also, what if there were a series of surgeries that one is involved in or has elected to have, and they're in, so let's say there's 4 surgeries. I'm just making for an example, or 3 surgeries.
Okay.
If they've had the first surgery and they have 2 more that are required to complete, does this bill prevent them from then having those other 2 upon passage and signage of this legislation?
Representative Kaplan.
Based on what I'm looking at here, and we can go out of legal or go to legal again, but I think if I'm not, we'll just, can we go to legal?
I'm fine.
Yeah.
I'll go out of session. I'm sorry.
All right. Without objection, we'll go back out of session. We'll go back to legal.
11 Crutchfield, Office of Legal Services. So under subdivision C1B, it's not a violation of the prohibition if the division provides medical assistance coverage or reimbursement for a medical procedure performed on or administered to an individual if the performance or administration of it began prior to the effective date of the act and concludes on or before March 31st, 2027.
Thank you. Thank you, Mr. Chairman.
Okay. Is that clear?
Yes, sir.
Did you have? Okay. While we're out of session.
Yes. Thank you, Mr. Chair. Under right now, TennCare covers elective surgery.
That would be a question for TennCare. I can't speak to what they do and don't cover. I'm not familiar with that.
Representative Parks.
Thank you. Is it not spelled out in the code what they can cover?
I believe that there's a section of code that talks about things that can be included in medical assistance, but I don't know if that covers the entire scope of what they do cover. I would have to look into that or speak to TennCare.
Okay. Thank you. Thank you, Mr. Chair.
Okay. We'll go back in session. Okay. Representative Parks, and you're recognized. Question for the sponsor.
Thank you, Mr. Chair. And Mr. Sponsor, does TennCare cover elective surgeries like this right now? Is that?
Representative Kaplan, you're recognized.
It is our belief. Yes, sir.
Okay. Thank you, Mr. Chair.
Okay. Any other questions? Representative Speaker, you are recognized, sir.
Mr. Chairman, move previous question.
Okay, previous question has been called. So, Madam Clerk, if you would open the board, we were ready to vote. All right. Would you take the vote for us, please?
Mr. Chair, you have 5 ayes, 1 nay.
All right. House Bill 2489 moves on to insurance full.
Thank you, Chair.
Thank
Appreciate
you. All right. That moves us to our third item, which would be House Bill 1101 by Representative Salinas.
Motion.
I don't know if we got a motion or second. I'm just kidding.
I think we got it. It's,
Yeah.
we're on the struggle bus after the holiday.
You are recognized, Representative Salinas.
Thank you, Chairman. What this bill does, it would allow the General Assembly to expand Medicaid under the Affordable Care Act that passed as federal law. It has been over 10 years since the Affordable Care Act passed. We are losing out on $1.4 billion every year that would go to take care of our people. We are leading the country in hospital closures here in Tennessee, and our people are sicker for it. And one of the things about Medicaid expansion that I have spent a lot of time looking at is how Medicaid expansion can also help in crime prevention, because people that get care, especially around mental illness and substance use disorders, in states that have expanded Medicaid, those numbers of crimes have dropped down, both violent and nonviolent crime. So not only is this bill about taking care of our people, but it's also about addressing crime. And it's hard to recruit business when you don't have working hospitals. Where are people going to give birth? Where are people going to go if they have a heart attack? So if we want to care about economic development, we have to care about the fact that our hospitals are closing because we refuse to expand Medicaid. So with that, I stand ready for questions.
Okay, thank you so much for that. I believe that we do have someone to testify this morning. So without objection, we'll go out of session. And we have Dr. Katrina Green. If you would have a seat there, if you would please identify yourself, and give me just 1 second, and you will have 3 minutes to speak.
All right, is this on? Okay.
Give me just a second and I'll start your time. You got it? Okay. All right.
Good morning. Thank you for allowing me to speak. My name is Katrina Green, and I'm a board-certified emergency physician. I've worked in hospitals all over Middle Tennessee, including Clarksville, Columbia, Lawrenceville, and Nashville. Every day, I see what happens when we don't expand Medicaid. I see the coverage gap in the form of the 60-year-old farmer who's ignored a cough for years, toughing it out because he can't afford a doctor's visit. By the time his breathing gets bad enough for his wife to drag him to my ER, I'm diagnosing stage 4 lung cancer. I also see it in the 45-year-old Uber driver who never knew he had high blood pressure until he got sick enough to end up in my ER, only to learn his kidneys had failed and he would likely spend the rest of his life on dialysis. Ironically, because of his kidney failure, he now qualifies for Medicare, but he is now too sick to work. The cancer patient, however, he'll likely forego chemotherapy because he doesn't want to be a financial burden on his family. These stories aren't just tragedies, they're failures of the system. Just like my patient who ended up on dialysis, Tennessee's rural healthcare system is an organ failure. Since 2010, Tennessee has seen more rural hospital closures per capita than almost any state in the country. Right now, 9 more of our rural hospitals are on life support, facing high risk of closure. And why? Because they're drowning in uncompensated care. In states that expanded Medicaid, hospitals saw their charity care costs, bills that never get paid, plummet by nearly $3 million per facility. If we act, we see an immediate 84% reduction in the likelihood of our remaining hospitals flatlining. When a rural hospital closes, the golden hour, the critical window I have to save a stroke or trauma patient, disappears. If you live in a county where the ER just turned into an urgent care or a parking lot, your mortality risk doesn't just go up, it spikes. States that expanded Medicaid have also seen a 50% decline in infant mortality compared to us. Think about that. Babies are dying at higher rates here in Tennessee because of a policy choice. Medicaid expansion also allows low-income women to access care before pregnancy, enabling them to manage chronic conditions like hypertension and diabetes. In Tennessee, mothers often enter pregnancy with untreated conditions, contributing to our high maternal mortality rate. For those of you who don't know, Tennessee ranks at the very bottom, number 50 out of 50 states, for 2 years in a row when it comes to maternal mortality. By not expanding Medicaid, like Representative Salinas said, we're leaving $1.2 billion in federal incentives on the table. That's money that should be hiring nurses and keeping the lights on in labor and delivery units in places like Pulaski and Sweetwater. Our rural health infrastructure is hemorrhaging. Medicaid expansion is the tourniquet we can use to stop the bleeding. It's how we can ensure that living in rural Tennessee isn't a death sentence for a treatable condition. Let's help the small business owners, the farmers, and the hard workers of Tennessee improve their health and life expectancy. Let's bring our tax dollars home and stabilize the heart of Tennessee.
Dr. Green, your time has run out.
Thank you.
Sorry. Okay. Does anyone have any questions for Dr. Green? Chairman Speakey, you're recognized.
Thank you, Mr. Chairman. Dr. Green, could you finish that thought?
Yes, my thought was just to please vote yes on House Bill 1101. Thank you.
Thank you, Mr. Chairman.
Thank you. Chairman Kumar, did you want to be recognized?
Sure, thank you. Uh, You bring valuable, okay. Thank you, Mr. Chairman. You bring valuable points, and we just have discussed them many times, and it's been a struggle for several years whether expansion of TennCare would add to medical care and what it will do and what will not do. And of course, comparing to the budgetary situations also. You probably remember how under Governor Phil Bredesen, we had to remove 240 or 60,000 people from TennCare because of, again, TennCare budget was ballooning. At the same time here, federal government may promise us 1 billion or 1.2 billion, but that part goes, falls progressively after 3 years to increase state responsibility. I have always felt that the federal government really wanted to cover those who cannot afford care or in a low-income group, then Affordable Care Act should have done that. What did they do? They took out the people who were the most needy because they were the poorest and put them in a category. You go to your state and get them TennCare, and the rest of them got subsidies. These people deserved 100% subsidy, and the problem would have been solved. The $1.2 billion that the federal government wants to give to us should be used to give direct subsidy to those people so they can get TennCare or get coverage on the Affordable Care Exchange or healthcare.gov. So those are the inequities that make things difficult and make budgetary decisions on part of a state that has to support education and build roads and do other things, makes it very difficult. Second point is that as far as hospital closures are concerned, lack of TennCare is not the only cause for hospital closures. They are basically corporate reorganizations. There are facilities such as the critical care access hospitals that the federal government supports so they don't close. And also, it is really urgent to understand that these hospitals complain that when we get TennCare patients, we lose money on them. How is that going to help the hospital if we give you more of those patients that these hospitals lose money on? So these are things that are very conflicting in that sense. But thank you for your comments, and I admire the care that you provide. Thank you. Thank you, Mr. Chairman.
Thank you, Chairman Kumar. Representative Parkinson, you're recognized.
Thank you, Mr. Chair, and thank you for your testimony. Where do you work, if you don't mind me asking?
I work at Nashville General Hospital.
Nashville General. And I don't know if Nashville General is the safety net hospital for, is it?
It is.
It is. Can you tell us the difference between those that are on the safety net and the amount of access versus those that are on the TennCare rolls and the amount of access, and versus those that have private insurance and the amount of access?
You're recognized.
Thank you. The difference between those who use our safety net hospital and those who have private insurance is the access to a lot of the specialty care. My hospital doesn't have every single specialist that someone could need. We have to refer patients out for things like chemotherapy, for cancer treatment. We can treat some strokes, but we can't treat blood clots in the brain. Someone that needs a neurosurgeon, they're going to have to get sent to another hospital. Those hospitals don't provide as much charity care as my hospital do. Those patients end up getting a much larger bill. That's another thing. Tennessee leads the nation, or is at the top, close to, in medical bankruptcies. So we're bankrupting Tennesseans by not expanding Medicaid and not giving them access to preventative care. That farmer that I talked about that ends up getting stage 4 lung cancer, that's something we could prevent, or at least catch early enough to treat it and not bankrupt his family. The Uber driver that ends up on dialysis, we can prevent that by treating that blood pressure so that patient doesn't end up with kidney failure. That's what my hospital does. We try to prevent things from getting to a critical stage. And without my hospital, every other hospital in Nashville is going to be absorbing that charity care that we provide. And that's why under Mayor Barry, there was a big backlash to closing our hospital. All of the other healthcare organizations, HCA, Vanderbilt, St. Thomas, Ascension, they all protested and said, we need this hospital because we're not going to be able to absorb the rest of that care. So when one hospital goes down, it ripples throughout the rest of the hospital communities. Other places need to pick up the slack, and they take on the burden of that uncompensated care.
Representative Parkinson, you recognize.
Thank you, Mr. Chair. Doctor, what area, and I may have missed it in your opening statements, but what area of the hospital do you work in? What department?
You're
I work in the
recognized.
I work in the emergency department.
Representative Parkinson, you're
Okay,
recognized.
and thank you for that. I'm a retired firefighter, so we're here. We understand each other. How often are you seeing that an individual that does not have health insurance is using the ED as their primary care?
You're recognized.
On every shift I work.
You're recognized.
Thank you, Mr. Chair. Do I need to look back at you every time, or can I continue?
Just, we'll let it go for just a minute and then
Okay.
we'll, yeah.
Okay. And how much of a strain does that put on the ED, and how does it affect access and service for other people, given the fact that they're using the ED as a primary care facility?
You're recognized.
So it increases the volume of patients that we see. And so that increases the wait times for anyone who needs to come to the emergency department. If you think about it, someone who's coming in for just something as simple as a medication refill, which I'm happy to do. I don't want you to run out of your medicines. If you are running out and can't see a doctor, come see me and I will give you your blood pressure medicine, your insulin refill, your antidepressants. All of those things are important for your care. But that is a patient that is taking up my time where, someone who maybe is having a heart attack is waiting in the waiting room to see me. And every minute matters when you are having a heart attack or a stroke. We don't need those patients to be waiting long times for care. And so we need to offload some of these patients that could be seen in the clinics by getting them access to a primary care provider, which they don't have if they're uninsured.
Okay, Mr. Chair, I'm just going to close with a statement. This is kind of indicative of how our safety net, while we appreciate everybody that does serve and help with the safety net, but the access is harder to get a patient into, or a person that needs service or help into a place like in our FQHCs. Because there's so many people and it's hard to get an appointment into there. And then in turn, if they cannot get into, it's hard to see a doctor. I got insurance and it's hard to get to my doctor now, right? And so imagine what's happening with those individuals that are on the safety net and they try to get into a Christ Community or another one of our FQHCs and it's so backfilled, it's such a long wait, but they have to have that help now. So the only place to turn is to the emergency rooms, which is causing a huge backlog and logjam of service being offered to our citizens. And I think we really have to do something else, do something better, so that we can, give people that access. Because somebody's family member, because of this, somebody's family member has actually died. They've actually lost a family member because of our inaction to expand Medicaid. And Mr. Chair, thank you for that. Thank you, ma'am. Thank you so much.
Thank you, Representative Parkinson. Any other questions for Dr. Green? Representative Love, you're recognized.
Thank you, Mr. Chairman, and thank you for your service. I have used Metro General on many occasions when I've had some issues, and also taken colleagues here who had issues and had to get there in an emergency situation. He recently had to go there for a situation with my back, and then had a follow-up at Metro General 2 days later. I got clearance. I have insurance, of course. I have a primary care physician, but the services were there and were available. And I think that's something we also miss, is not just the initial visit that is necessary at the hospital, but it's the follow-up. It is the aftercare that gives you the assurance that when you leave the hospital, that you can be seen by a doctor and you can have follow-up and you can have others who ask you about what's going on in your life, absent of even just having a primary care physician who can then on an annual basis evaluate you and check in on you. So I think that's one thing that we need to also talk about, all those other services that are provided for a patient when they come, and the confidence level that one has when you are dealing with an episode, whatever it may be, whether it's a heart issue, it's a physical issue with your limbs, or it's something else going on with inside of you, to be able to know that you can then go to the doctor and have an evaluation. And so I think there's an important conversation to have about that. I know that we can look back upon all the things that we should have done right. There's always a chance for us to go forward and make things right. I think as we talk about the issues that our city is facing across expansion of population, we know that Nashville General has its own ordeals with the population, but we'll also be dealing with other counties who will be sending patients there. Same thing with Region 1 in West Tennessee, Erlanger in East Tennessee. And so I think that's a conversation that our colleagues need to have about what impact an increasing population in Tennessee, in Nashville, in Memphis, in Knoxville, and our surrounding counties will have as we draw more folks to Nashville. Because think about this, to Tennessee, because we are not saying to folks, don't come to Tennessee. Matter of fact, I think we're doing a bang-up job of recruiting people to come to Tennessee. I see the advertisement, recruit folks here. So if we're inviting folks here, we also that brings with it also an increased population and a strain on our services. So I would encourage our members to think about this as we go forward and consider this piece of legislation as we want to make sure that we keep our healthcare costs within a certain level, but also the cost, again, as my colleagues have talked about, of people getting care and not being able to get care and then suffering and dying. So thank you for your service. Thank you for being here. And I ask my colleagues to please consider, and thank you, sponsor, for bringing this legislation.
All right. Any other questions? Not. Dr. Green, thank you so much for your testimony today. We'll go back in session. Any final comments? Representative Salinas?
Yes. Well, I just wanted to answer a couple of the questions. Dr. Kumar brought up Phil Bredesen. Phil Bredesen was governor before the Affordable Care Act passed. A lot of the changes that we had to TennCare through waivers happened before the Affordable Care Act passed. We're in a different situation that we are paying these taxes. These taxes came after those enrollments and disenrollments happened. So it's not apples to apples comparison in the moment that we find ourselves currently. Regarding the 3 years reimbursement going down, it goes down to 90% and then remains at 90%. 40 states have seen this stay consistent. It has not changed since the Affordable Care Act passed. So there's no reason to believe that that would change moving forward. There hasn't been legislation at the federal level that has changed those reimbursement rates. And then regarding the marketplace, we just had the longest government shutdown over healthcare. There was a 3-year extension, but we're failing the people of our country by not addressing healthcare consistently. And it's easy to be against something, yet no other proposals come down the pipeline that are other options. So to me, it's disingenuous to suggest that as an option when we shut the government down because there was no other option. And their best option was extending the subsidies. And we were able to do it for 3 years. So I stand ready for any other questions that are remaining.
Okay. Chairman Speaker, you are recognized.
Move previous question.
Okay. All right. Previous question has been called. So, Madam Clerk, if you would open the board for us, please. Madam Clerk, if you would take the room or take the vote, please.
Mr. Chair, you have 2 ayes and 4 noes.
Representative Salinas, House Bill 1101 fails.
Thank you, Chairman.
Next is also Representative Salinas. House Bill 1104. You have a motion and a second. So ma'am, you are recognized.
I would like to take that bill off notice.
Want to take it off
Yes.
notice? All right. Without any objection, House Bill 1104 will be taken off notice.
Thank you.
House Bill 1836. Chairman Hill, you're recognized. We have a motion. Do we have a second? I will second it.
All right. Thank you, Chairman. House Bill 1836 increases the rates we pay for our ground-based ambulance services for emergency and non-emergency runs. Currently, TennCare MCOs are required to pay ambulance services 67.5% of the Medicare rate for each run. This would increase that to 110%. Yes, sir.
We do have a motion and a second. And Chairman Hill, you have explained the bill. Right?
Yes, sir.
Okay. Members, do we have any questions for Chairman Hill? Okay. The current rules are that you must ask to be recognized first, and then kindly, you're most welcome to. So let's walk through it again. Representative Parkinson, you're recognized.
Thank you, Mr. Chair. I was giving you this opportunity, throwing you an alley-oop to rule me out of order, but you didn't take it. And so I can't call, can I even call it now since I said something? I can't. So thank you, Mr. Chair.
Stay on the bill. For that, you're out of order. Representative Spicky, you're recognized.
Thank you, Mr. Chairman. Move previous question.
Okay. So that is properly done, and that's how it is done. Members, previous question has been called. Madam Clerk, please open the vote. And members, please register your vote. Madam Clerk, please count the votes.
Mr. Chair, you have 6 ayes and no nays.
Okay. House Bill 1865 moves on to full Insurance Committee.
Thank you. All right. Does any other members have any? Okay. Representative Love, you're recognized.
Thank you, Mr. Chairman. Thank you for your patience this morning. I do want to make members aware that today we have the wonderful Lemoyne Owing College on campus for their Day on the Hill. And you have a good number of men who are going to be wearing purple and gold because it also is Omega Psi Phi Day on the Hill. So you will see men walking around with purple and gold. Lemoyne's colors are also purple and gold, so don't confuse the two. But members like myself, Sam McKenzie, and Vincent Dix are members of this great organization. So glad to recognize the Omegas that are here today, Mr. Chairman.
Thank you. We welcome them to Cordell Hall today. All right. Without any further orders or announcements, we stand adjourned.